5 on your mental health tonight. Getting in shape for summer. For many people, the idea of wearing shorts, bathing suits, again, it's good motivation.
But for others, it can cause an overwhelming amount of anxiety. Here to talk about this, Dr. Jennifer Thomas, a clinical psychologist and the co-director of the Eating Disorders Program at Mass General. Doctor, thank you very much for your time.
Thanks for having me, Erica and Ben.
Yeah, thank you, Dr. Thomas. So this affects both men and women, and you have a lot of patients who really struggle during the summer months. So what do they tell you about their challenges?
Absolutely. Today, so many people are ashamed of their bodies. You really can't achieve that perfect 10 without an Instagram filter or Photoshop. I've had patients who've fasted for days before going on a beach trip or run on the treadmill for hours before they let themselves go to a pool. Recently, I worked with a little girl who wouldn't even let herself eat cake on her own birthday because she felt like she was too fat. That one really broke my heart.
That's heartbreaking for sure. So what are some of the warning signs that maybe a family member or a friend might notice?
Well, when people think of eating disorders, they usually think of extreme cases, like people that weigh 70 pounds. But only about 1 in 200 Americans will ever have anorexia nervosa, and more like 1 in 20 will have other kinds of eating disorders. So some of the things that you could ask yourself about a loved one are they severely restricting their food intake? Do they have dramatic shifts in their body weight? Do they binge eat when no one else is around? Do they try to make up for calories by vomiting or taking laxatives? And do they avoid things that are really important to them, like at social events, because they feel bad about their bodies?
Okay, so if you do think someone has an eating disorder or disordered eating, what's the next step?
Well, first, you want to let them know that you care about them and talk to them about it. It's really important to use I statements to kind of describe what you've noticed. So you could say, I've noticed you've been skipping meals, or I'm worried that you haven't been feeling good about yourself lately. And then you can let them know that there are treatments that are effective and really help people. A lot of our research at Mass General Brigham has shown that the majority of people do recover from eating disorders over time. We have a lot of really effective therapies right now, ranging from medication to psychotherapy, like family-based treatment, and cognitive behavioral therapy. And lastly, if you're the one who's struggling with your body image this summer, let me write you a prescription for retail therapy. It's important to go out and buy yourself that pair of shorts or a bathing suit that fits you now, not 5 pounds from now, because you're worth it.
All right, good advice. All right, Dr. Jennifer Thomas with Mass General, thanks so much for your time. We appreciate it. Have a good weekend.
You too.
Yeah, thank you, Dr. Thomas.